Welcome to Accessible, the podcast that opens the door to disability leaders and their ideas. I'm George Gatto.
And I'm Amelia Reigard.
We are doing something a little different in this special series called Voices of the Network. Over the next few episodes, we will highlight university centers on disability, which are currently facing funding uncertainty in the proposed 2026 federal budget.
We'll explore how these programs came to be, their bipartisan roots in the Developmental Disabilities and Bill of Rights Act, and the impact they have on people with disabilities, families, and communities across the country.
Through conversations with national and local leaders, trainee alumni, and professionals, we'll shed light on the real-world value of USEDS, LENS, and other DD network programs. These are stories of leadership, innovation, and impact.
Welcome back, folks. Producer Kat here with another intro to the episode. So today, George and Amelia are joined by Marcy Moriarta, who leads the University of New Mexico's USED and LEN program at the Center for Development and Disability. So double duty there. We got to hear about so many cool and creative programs that are having a huge impact for people with disabilities. Honestly, what really stood out to me was Marcia's reminder that the true impact actually begins with human connection. What a concept. I loved hearing all of her stories about their work in New Mexico and how it's all connected to the larger network of university centers across the country, which is what we're doing here with the Voices of the Network series. So totally worked out perfect. A quick note, as of this recording, Congress is still in the appropriations process and funding for USEDS is at risk. You can help protect the future of disability services, research, and training by contacting your members of Congress today. For the latest policy updates and information on how you can make a difference for the future of disability programs like ours, visit the link in our show notes.
Well, we are so excited today to have Marcy Moriarta joining us. She is both a USED and a LEN director from New Mexico. And Marcy, welcome.
Thanks, George, and thanks, Amelia. Thanks for having me. I'm glad to be here.
We're excited to have you.
Yeah. And I heard Amelia talking earlier. She and I feel the same way. I actually grew up right on the Colorado-New Mexico border. So
Oh, you did?
yeah, I did.
Yeah. All right. Well, you guys are welcome anytime to come visit. And the great.
We will take you up on it.
Right near Raton is where I grew up.
Oh, really? Yeah, that is not where most people grow up. So that's cool, George.
Yeah.
Yeah.
That's very nice.
Yeah.
But not a lot happening there. So, Marcy, what's happening in New Mexico? You guys have so much. I'm always so impressed with everything that you do. You want to just talk a little bit about how you are serving your state and working with people with disabilities in New Mexico?
Yeah. I feel incredibly kind of blessed and privileged to be able to have the roles I have in the state of New Mexico because, as you know, having grown up near here, that we have a small population, relatively speaking. We're about 2 million people statewide, but a huge land mass. We're the 5th largest state, by land mass in the country. So we have a lot of rural areas. Most of the population is in the metro Albuquerque area, but that still leaves a lot of folks in our rural spaces. So our USED, in spite of being in a relatively small state, is relatively large. We're part of our health system. We report up through our School of Medicine. So USED sort of sit in all sorts of different spaces in universities, but we're part of that component of the University of New Mexico, the health system side. And I think that's really enabled us to be very flexible and creative with some of the work we do. So we do a lot very directly in the space of intellectual and developmental disabilities. We have a huge autism programs. All of this is statewide. But we also kind of serve in a lot of other, what I would say, ancillary spaces because the nature of being a USED allows us to be maybe like the place things can get done where things can't get done in traditional healthcare or traditional education systems. So I'm actually working on a document right now kind of showing the breadth of what we do so I can freshen my mind. We do a lot of work in the autism space. We have what we call our autism programs. And it includes our autism diagnostic clinics, which again are statewide. They are birth through adulthood. It includes a real peer family support component where we have family members who have raised children with autism who are here to support any parent across the state, any family across the state for a child of any age. It could be a 28-year-old or a 2-year-old with a new diagnosis around just what are you needing, supports, just someone to talk to, as well as connecting you with resources, anything at all. We also have parent home training and coaching and other intervention programs that we, again, will provide statewide, either in person in a family's home or via telehealth to support them at home with their loved one who may have a diagnosis of autism or other neurodevelopmental disabilities. We are really hoping to build our fetal alcohol spectrum disorder services. We have always had a diagnostic clinic, but that's become a labor of love for me to bring more attention to that area of neurodevelopmental disability and kind of reduce stigma. So we are working on developing a parent support component in that space as well. We have huge employment efforts. We do a lot of the technical assistance and training across our state around employment of people with intellectual and developmental disabilities. So everything from competitive employment to supported employment. We have a project search implementation. So we're doing a lot of that technical assistance across the state and sort of how do you successfully employ people with disabilities and successfully and appropriately support them. Yeah. We do a lot in the early childhood and maternal child space as well. And that's sort of been my historic area is I'm a clinical psychologist by training in infant and early childhood development, disability, as well as mental health, trauma, adversity, children in child welfare systems, that kind of thing is also a large part of what we do. And we have a continuum of direct service programs that range from home visiting prevention. We have a nurse-family partnership implementation. We also do other models because there's sort of some rigid standards about who can enter nurse-family partnerships. So we do other models to be sure we can capture people across their need. In nurse-family partnership, you have to be pregnant to enroll. So we're not always capturing the highest risk folks during pregnancy in our state. We do a lot of work with opioid-exposed babies, babies that have been exposed prenatally. And we actually have a specialized Part C early intervention program that partners with a family medical clinic so that if mom is struggling with opioid addiction, she can get her medical treatment, her MUD, her medication-assisted treatment at our family practice clinic, and the baby can come in for well child checks and everything at the same time. So we partner around that. I could go on. We do a lot of training and technical assistance across our Part C and home visiting systems. We have really strong partnerships with multiple state agencies, our Department of Health, our Healthcare Authority, which is what runs our Medicaid systems. So I think really being in New Mexico, it's like a big, small town. So the luxury in that is you kind of know everybody. And so if the cool idea comes online, you can get it done.
Do you have, I always think one of the cool things about New Mexico is that you have a really interesting population and that you have a lot of Native American communities throughout the state, as well as Latino communities. And how do you engage with those communities?
Right. So that's a great question. So in fact, we have some specialized programming we're doing for Spanish-speaking populations. We have sort of an ongoing training series, and training, I use the term loosely because it's really geared for families and parents who are Spanish-speaking, who are raising children and/or individuals. Children grow up who have developmental disabilities, autism, as well as other developmental disabilities. And so it's sort of a regular, consistent space where the community can come together and they pick the topics that we're going to speak on or get speakers to come talk to them. And it was interesting when we first started doing, we had a lot of providers showing up who wanted to monopolize the time. And we had to say, providers can listen. Families get to talk and ask the questions. And then the providers can maybe become provide resource. So we're doing that regularly with the team here. We also do something very similar called Weaving Colors with our Native American populations, where we're really using it as a space to dialogue and bring families and individuals together to talk about sort of through a culturally appropriate lens, like, what does disability mean? What does it mean to have a diagnosis of autism in this community, in this family, and we learn from it, as well as we're able to provide a forum for information to come to the fore for families to share with one another. I mentioned our home visiting programs. We really gear them. We kind of originated them to be sure that they would serve Spanish-speaking populations in our metro area where we're located. This was probably 12 or 14 years ago when we did sort of an analysis. Some of the worst or birth outcomes were happening in these pockets of the city where we had a lot of Spanish speakers, many of whom, at the time were immigrants and not necessarily accessing prenatal care. And so the goal was really, from a public health perspective, to help them, feel safe to get prenatal care. We are seeing a cyclical return to some of those fears, as you can imagine, but it's really helpful that we have 14 years embedded in these communities with home visitors, mostly women, who can speak Spanish, often live in the community, and are trusted. So those are some. We have bilingual clinics that we run regularly for our evaluation services, and have a very dedicated set of providers on that team. So yeah, those are some of the things we do.
Marcia, you provide such a breadth of services, it sounds like, in programs within the state. And I'm just wondering if you could talk a bit about, from the perspective of individuals or children with disabilities and their families, what does it mean to them to have these services in their state? You talked a little bit about just that because of you said the way that it's set up, you get to operate and provide things that wouldn't maybe necessarily exist in a hospital system on its own, right? You bring this extra capacity. So could you speak to that a little bit? Just what it means to families and individuals, and how it's really innovative way to support?
Yeah, I think I'll use an example from one of the programs I actually didn't mention, and it's relatively new for us, but it is just taken off, which is we are implementing the START model, providing supports for individuals with intellectual and developmental disabilities who have co-occurring mental health challenges and often are in crisis, needing hospitalization. And in our state, for many, many years, the program serves anyone from 6. We've even had someone who would be considered geriatric on the program, who was dealing with a diagnosis of autism and dementia, and saw just terrible regression in their behavior after years of being stable. It was an individual that actually worked at our center. But what this program has really allowed for is for people who were actually not able to live in our state because they would go to Kennedy Krieger or they would go to a neurodevelopmental unit in Texas because they just couldn't be maintained safely by their family members, their loved ones. And hospitals, we have a limited set of resources here. We don't have a lot of residential facilities or other spaces, and they weren't able to be in more traditional group homes for, folks with developmental disabilities because of their behavioral challenges. And we are finishing our second year of implementation in August. We probably have 65 individuals enrolled in the program right now, and many of them would be living out of state if we had not begun this process. And we sit outside our traditional mental health care service system here at our hospital. So the bringing on of START, which is really more of a systems intervention, has kind of opened the eyes of our leadership here at our health sciences center to say, we understand that we cannot manage the level of complexity we're looking at without kind of a different space. So I think our center has really provided the ability to implement a model that brings the psychiatrist, brings the teacher in, brings the mom in, brings and just show there's sort of a different methodology to address these complex things that often get reduced to like med management in other spaces. I don't know if that really answers your question, but it's really been a very remarkable space for us to do this in New Mexico, and then watch our more traditional medical model providers be like, whoa, I want to be a part of that. So we have like psychiatrists that want to work over here now with this population nobody wanted to work with, right? They were too hard.
Yeah.
And I'll just share a little story because it tells, like, this is one of my favorite stories. You have a young woman who has significant intellectual disabilities, but every couple of weeks, like clockwork, she would sort of, as her team would say, blow out and wind up needing to go to the hospital from her group home where she lived. And the STAR team kind of went in and did their, month-long evaluation of what's happening. And it really turned out that she is bored out of her mind. She's aware that the workers don't love her because she's hard, right? And from their vantage point, and she's lonely. And so this is coming from a positive psychology model. So our team just flips the dialogue and it's like, well, what would help, right? So we have a coordinator that works with her. This is a bachelor's prepared professional who now every Friday goes in and they make jewelry together. We have not had a hospitalization in 9 months. And I'm just, not everything is this magical, but sometimes we're putting really heavy duty intervention on things that are really more about human needs for connection, something to look forward to, relationship, right? And for me, even within the disability field, people who work with individuals with intellectual disabilities sometimes forget they're human beings, so I don't know, I don't want to overstate that, but I mean, this young woman also knows because she's built relationship with her coordinator. If she starts to feel lonely, she can reach out. She has someone to call who knows her, who she believes cares about her and can sort of be like, okay, what are you going to do? And so it sets the stage for other supports and interventions. And now, the group home workers all like her better now because they can see that, she's not just creating difficulty for them. Right.
Right before we got on to this conversation, I was working on a report on a statewide needs assessment that we did in partnership with our Developmental Disabilities Council. And I was just looking at the data about what is most important to the people with DD who responded to our survey. And I was actually a little surprised because I'll just read you like the 5 top things. Parks and rec activities, community social activities, community friendships, achieving personal goals, and leisure and hobby activities. All of them are, directly related to being in the community and somehow engaging in a social life. And, here I was thinking, oh, they're going to want transportation and they're going to want employment and those sorts of things. And those weren't even in the top 5. So.
Yeah. Interesting. Yeah. I think that this example illustrates there's many other things she needs, but fundamentally, if you feel like you've got connection and some fun things to do in your life, you can endure a lot, right? You can weather a lot, any of us. So, yeah.
And I think too, what sticks out about this example to me, and I feel like what's coming up as a theme in this kind of Voices of the Network is the value that USEDS and LENS bring in that interdisciplinary approach, instead of just approaching it from one lens, from one model, the medical model, right? Or from education, right? It's like bringing together different diverse perspectives and theories and practice to then say, let's figure out the best way to meet this individual's needs, maybe in a clinical setting, or the best way to do a community intervention because we're doing that interdisciplinary work.
Yes, absolutely. And, what I would even say extending that is, the START methodology originated at our sister USED in New Hampshire and is now sort of taking the country by storm as the evidence-based intervention in this space. And it really is what's the word I would use? It's a second order change. It's a transformational kind of method because it really does sort of say we have to work with all the players involved and we got to figure out who this person is, right? And not just sort of be like, how do we manage the disability or disorder, right? Which is just really traditional medical model. So to me, it's like the nested relationships or those nesting dolls. We're nested within this interdisciplinary space, but we're also part of this larger network and community where we can take the resources that were developed by another USED and say, hey, that is over here. And then we're all in community together. Like I get stuff all the time. The other thing START sort of forces us to do, which we weren't doing before, is we have a once a month community training event as part of it. And I will just say to you, like, this is subtle but important. Like, we do a lot of training at our USED, and it's often like Autism 101 or what is fetal alcohol spectrum disorder. These trainings are things like, bullying in middle school with kids with autism, right? Like, it's much more specific and applied. And I think it's helping us think, like, we have so much knowledge here. We don't just need to be at these high levels describing. We need to, like, oh, what do you do? Violence and, dating and autism in teens, right? Like, it's this kind of thing that now our teams are talking about and finding people to train with them on. And man, we get a lot of people showing up for these trainings.
Is it just individuals with autism, or are family members coming to that, and professionals? How do you structure that?
It's the community events that are part of the START model are for anybody. Yeah. And we're getting a lot of professionals, but we're getting a range. And it really depends on the topic. And often they're like filling up really fast. So we've been figuring out how we can open it up to more people.
Yeah, I love that. I love that it's you've got that inclusive sort of classroom happening.
Yeah, it's pretty cool. I'm proud of it. And I have to give credit to the team and Pat Osborne, who leads the team, and Tiffany Otero, who is the clinical director. They have really just knocked this out of the park. And it, as a USED director, that's what you want. Like, my team is doing great. I can just brag about it.
That's awesome. You bring up that really great point, though, Marcia, about the network of USEDs, right? And LENS, and how we, having that designation creates the impetus for us to share with one another what we're studying, what we're learning, and that best practices or evidence-based practices could spread like wildfire when we have these, ways to get together and convene, right? Through national meetings and channels of information, that really draws us together and makes more effective practices in our states. What you're doing in New Mexico, I've already written like several notes of like different researchers and program directors here that I need to connect with you, Marcia, and some of your program leads, right? Because I'm like, oh, we do a lot in substance use recovery and maternal and child health, right? We do a lot in these spaces, early childhood as well. And so, it's exciting to learn from one another and see what we can do to help people in Missouri based off what you're learning in New Mexico, right?
Yeah. Yeah. And vice versa. Cause, it's sometimes so helpful to see what's happening in other states, even if you're working in the space, cause you get locked in with your own systems. And I think more recently, and, some of this is just probably my development as a leader and our USED's development, because we're in our 35th year now. It's just things evolve, right? Like, but to challenge some of the systems rather than feel like we've got to kind of fit what we do in the system. So it's always nice to see what's happening in other places. Like, there are other ways to do this, and be ready when the opportunities are there in your own state. Yeah. But I mean, I think, I think we all know sort of federally, the risk we're facing across, the current administration's goals to kind of eliminate funding for USEDs. Our center will survive, right? We're big enough, we're embedded in our state, but what we will lose is this really important leveraging across, and that's maybe not, that's the word we always use. There's got to be a better word, but it is a huge loss to not be, we are successful in part because we're able to access folks like you and our other partners and talk to other people and amplify the things we know are working and get rid of the things that aren't. And I just, we would not, we've been looking at START for 5 years. And when the ability to gain some funding, and we actually invested some of the USED's funding in this to just say, we got to try it, because we are so tired of hearing from families whose kids have been out of state for years, right? They cannot live in their own communities. And once we did it and demonstrated it, we were able to move it forward, but we couldn't do that without our sister programs or without being part of this network, right? We just couldn't.
Yeah. Yeah. And I think of USEDs, sometimes we play these behind the scenes role, I think is what I'm trying to say. And cause we do these cross collaborations, right, with different partners. And
but the network in and of itself does a lot of problem solving around these issues that people with disabilities and their families are facing, the concerns that they have. You're talking about, families separated by states because of lack of services or lack of evidence-based practices and solutions. And so, just the value added to having like an organization that's dedicated to like solving some of these problems, right? And figuring out what works best.
Right. I think what you said, Amelia, is really important, because I do think we often take the role of being behind the scenes, and that may be part of our, that makes it harder to be really clear with people, like how important you are to what you do. You know what I mean? And I think that's one of the great beauties of being in you said we partner, we collaborate, we don't necessarily have to take the credit, right? But then you face some of what we're facing and like, well, what do you guys actually do? It's like, well, so many things, but after item 10, you're going to be zoned out and not really hear me, So it's a challenge to kind of find meaningful ways to say the depth and breadth of what we're doing in our individual centers as well as across our network.
How many people would you say you said impacts, like people with disabilities or family members on a?
That's a really good question, George. I should probably try to come up with that number. I mean, gosh, if I just sort of count in my head across the numbers of people I know that are even just directly served by our direct service programs, let alone our training and TA programs, just direct services is at least multiple thousands of people across our state. And then you add the training and it's like, hundreds of thousands, and
Yeah, you actually have some really great numbers too on your website. I was looking at your website earlier today, actually. And so you guys have and we'll share those in the show notes, but you guys do have some really great numbers of the people that you reach and kind of the breadth of activities that you do listed right there.
Yeah. I don't have them off the top of my head. And we're working on our annual report right now. So,
right.
Yeah. Well, I was just, you've probably done this too. I did, was just in DC, saw a bunch of other USED directors were all, trying to advocate for our programs and help educate. And, it was just like given, like at our USED, for example, I think we have around 90 proactive projects going on right now. And so how do you distill that into, a very concise, talking points that you can share with your legislators and others, so that they still are able to understand the impact of the thing. And then the one number I could come up with, or the one thing I could kind of think of was, well, here's how many people we touch in our state, So,
we're fortunate, I think, in this time to live where we are because we have we're sort of singing to the choir with our federal delegation and even internally with our state government, right? We're sort of, New Mexico is historically a purple state, but right now we're a decidedly blue state. So I think we have some, we absolutely have the support of our delegation, but even then we are getting lots of questions like, how does this affect people in my district? Right. So that's the kind of stuff we've been dealing with, like, what programs actually touch my district. And the good news is most of the things we do are statewide, unless it's like a local home visiting program. We're not going to drive 4 hours. There are other providers to do that. But that's where we've been, is kind of trying to parse out what are the most important things for certain people to hear. And then say, and we do other things, but you're asking what's most salient for your constituents, right? So that's kind of an approach we've been taking.
Yeah. I think we started this, Marcia, by talking about the several hats that you wear, right? As a LEND director, the USED director, and you also were a LEND alumni yourself. And so I guess thinking through all of your journey kind of through the network and all those hats that you have worn or currently wear, is there something like a moment in your time in the network that really sticks out to you, a story or something that you hold dear?
Yeah, actually I was thinking about this and, being the LEND director this year, I really thought I would just do it as an interim while we recruited, but I'm going to do it for our final year. And it brought me all the way back to when I was a LEND trainee at Children's Hospital in Los Angeles. And that was it. This will be 30 years ago this year. So I was told as part of my psychology internship, because I wanted to work with kids and families, that I would be a LEND trainee. In all honesty, I had no idea what it was. And it changed my life. And I have this really vivid memory of, we used to do clinics as part of our LEND program. And I remember I was one of the first to do a clinic, and you would do it in front of 40 people. And it was pretty old school. Like you were on a video feed and doing this. And I was charged with evaluating a young child. And at the time, this was back in the 90s when we were still using the term mental retardation. And so this goes back, but we were literally doing an evaluation, and that was the topic of the day. So I am green as the grass as a clinician, evaluating this child who most definitely had a negligible disability. And I then had to also give this feedback to the family in front of the entire LEND community. And I just remember working with my supervisor who helped guide me, and just how do you hold this kind of information in a space with a family who maybe is part of them is expecting it, but isn't really expecting it or prepared for it. And I just remember thinking, if you really think you want to work with kids and families, you need to be here, because they need people who care. And, and my mentor was amazing and all the things, but I was so green, and I had that experience, which just kind of, I don't know, it just motivated me to continue and just, feel like I want to be a part of this space where we can, I don't know how else to say it. Like, I don't know if that's the right way to hold families in these realities over time. Because the other thing, I was trained as a clinical psychologist, and you get steeped in psychopathology and all the medical model. And I was working with a developmental psychologist in LEND who was like, for kids with developmental disabilities, we measure progress sometimes in teaspoons, but you need to learn to pay attention because it's there. And I remember just thinking that was so poignant and beautiful. And I wanted to be a part of that rather than, you're working in a more traditional medical model. So it's very sort of formative for me. And if anybody had told me then I would be the director of a USET, I would have told them they were sort of off their rocker. I wanted to do evaluations and be a clinician. But here I am. So,
wow. Very cool. I think the people of New Mexico are probably really grateful for your that you were voluntold to be a LEND trainee back in the day, because it brought you into this field, and like now you're changing these spaces. So I think it's a great impact story.
Yeah. No, I think LENDs are very impactful. And I feel like we have several folks here who have been in LEND programs elsewhere or done LEND as being part of other community providers that have come to work for us. And it really is, I don't know that we capture the impact of LENDs as well as we could either, because I really do think they change people's lives,
Yeah. I think when you think about providers, healthcare providers or other providers you're working with families and kids, like your most treasured people in your life, and you want them to be equipped, right, and ready to deal with this delicate information, right, and to meet your needs, and to, like you said, I think it's great wording, hold space for all that diagnosis might contain, right, and really helping them set their trajectory as a family after diagnosis. That's really important. After learning about LEND myself, just being in this field, I think it's wild that not everyone gets that opportunity as practitioners to learn the skills that LEND trainees get to learn.
Yeah. Well, and they don't, so, when you do, it's very special, and it does seem to make a difference for people.
Yeah. Well, Marcia, thank you. This has been an excellent conversation. I loved learning a little bit more about your work and about what you said and the LEND in New Mexico. If people want to learn more, where can they go?
Well, probably the best place at this point is our website, which is our center's title is the Center for Development and Disability. And the website is cdd.unm.edu. And that's a great starting point. You can see the breadth of our programs and see contact information and all that good stuff.
That's
So,
great.
yeah.
We'll definitely put that in the notes below, the liner notes. So thank you, Marcia. I really appreciate your time.
Thanks, Amelia. It was lovely to talk with you guys too. I appreciate it.
Yeah, absolutely. Thank you.
Thank you for listening to this episode of Accessible. Accessible is hosted and produced by George Gatto, Amelia Reigard, and Catherine Toller from the University of Missouri, Kansas City Institute for Human Development, which is the home of the Missouri USED. Accessible is a joint project between the Missouri USED and the Missouri LEND program, which is funded by the Health Resources and Services Administration of the U.S. Department of Health and Human Services through grant number T73MC00022. Episodes of Accessible are released every 2 weeks and can be found wherever you subscribe to your podcasts. Join us next time to hear more insights and ideas from leaders in the disability world.